Hi guys, my name is Lexi. So my topic for my presentation today is the unrealistic price of insulin. So this was a study done by Biomed Central Services. But before we get into that, I just want to touch on what diabetes is, just in case. It's a disease in which the body's ability to produce or respond to the hormone insulin is impaired, which results in abnormal metabolism of carbohydrates and elevated levels of glucose in the blood and urine. So people with diabetes use insulin every day to survive. They need it every day to survive. But this article focuses on the price, availability, and affordability of insulin. Not only is this study focuses on China, but this is also a global issue as well. But it focuses on China because they have the heaviest burden of diabetes in the world. So this was a study done in 2016 in China, like I said. The data was collected in the capital as well as 5 other cities. So it covered 30 public sectors, such as hospitals and primary care institutions. And then it also went over 30 private pharmacies as well. So they got samples and numbers and data from each one of those. And then the main points of this article were, like I said, the insulin pricing, the availability of insulin, and affordability. So starting off with insulin pricing, throughout the article they are expressed as median price ratios. And the increase of pricing was due to import duties and taxes as well. So those bumped up the pricing as well, which they explained. And the median prices of all insulin types were about 1.36 to 2.59 times higher than other countries. And remember, this is in China. The largest component to patient pricing was 60% increase of the manufacturer's selling price. So they were the ones who really bumped up the price of that insulin. And then to go into availability, the mean availability was highest in public hospitals compared to the primary care institutions or private pharmacies where it ranged from 10% to 33%. So there's a huge difference there. And then going into affordability, they used the number of days of wages of the lowest paid unskilled government worker as like a base for their research, and how much they would need to purchase a 30-day supply of insulin. So they found that a patient with those qualifications needed to pay 4 to 16 days worth of wages for that month of treatment. So kind of going into why I chose this topic. So my mom was diagnosed with type 1 when she was around like 24, 25. She got it from when she was pregnant with my brother. So a lot of times people with type 1, they have to go through a certain like experience or time in their life or something triggers it. So for my mom, it was her pregnancy. For my cousin, when she was 11, which was about 2 years ago, she got diagnosed with type 1. It was her going into like puberty and like all those changes. It kind of triggered her type 1 to come out. Same with my good friend. She had the same situation when she was around 11 or 12. And then a story with her later, she went into diabetic ketoacidosis, which is when you have a lack of insulin. People with diabetes go into that state of like shock, and long story short, her blood started turning into acid. So her body totally deteriorating, very life-threatening. So that is what happens when you don't have insulin when you're a diabetic. And then my mom shared that for her single pen, which is like a month's supply, it costs nearly over $260 before insurance. So luckily we have insurance to like help out with that, but still it comes around to like $90-$100. And then most diabetics also use other technology, such as insulin pumps, which can cost even more than just the pens. And then this little diagram that I put on the screen here just shows the increase of the price of insulin prescriptions from 2012 to 2016. All right, so the main argument of the article that they brought up was that governments should consider using bargaining power to reduce prices, abolish taxes on essential medicines such as insulin, and develop strategies for more equitable access to insulin. So again, they're hitting those 3 points that they go through the entire article. So poor access to affordable insulin results in serious and needless complications and premature death. And then insulin overall must be easier to access and more affordable to avoid those complications and premature death. Alrighty, this perspective was written from a scientific perspective because it was written by that Biomed Central Health Services research. It was backed up with research and data collected from multiple areas and sources to provide a wide range of data. All right, the intended audience of this was, I would say it's the general public. It was made to inform people of the outrageous pricing of an essential drug. And then the biases would be those who can't afford insulin, because for those who can still afford to pay the full price, it still is a major expense considering it's an essential. Alrighty, going into rhetorical appeals. For logos, the researchers used reasoning facts and evidence based on their study, where they gathered the data and numbers from those 5 different cities. So example is that quote where it says, although the availability of short-acting and intermediate-acting human insulin was low, 70% of public hospitals had rapid-acting and long-acting analog insulin. So that's just like an example of one of the facts that they had within that article. And then the ethos they used was the credibility of that Biomed Central Services research team to persuade the readers that they are in fact getting the right numbers and sharing true information. Alrighty, pathos. There is evidence of pathos throughout the article. So when they use the numbers for life expectancy and death, it's more towards the beginning of the article. They talk about like the death rates of young children with diabetes and those who had less access to affordable insulin. So they use the example of the sub-Saharan Africa, the kids born there with type 1, they have about as low as 1 year life expectancy with that type 1 diabetes. So this brings out people's emotions with those examples. Alright, some strong points that I noticed. It used data from China, which is, like I said, the biggest country that is affected by diabetes. And it took data from several cities as well as the capital in order to get more accurate numbers. It was informative and easy to read. It was easy to trust considering it is written by that research team. Some weak points that I recognized were, in our case, it would have been nice to have some data regarding like U.S. numbers, U.S. costs of insulin, just to like compare. They didn't go into specific costs of the production of insulin either, which I know just from like personal research that it's very, very cheap to manufacture insulin. So they are bumping up that price to make as much money as they can. And I think those facts could have backed up their points regarding the manufacturer's price increases and how extreme they are, and it could have backed it up and helped them out a little bit more. So my opinion, I came into this obviously with a personal relationship and experiences involving this issue. I think since it's needed to survive, it should be affordable to everyone. And it should be readily available as well. Governments around the world should consider lowering taxes and manufacturing pricing on insulin. So basically exactly what the article said. So this article just helped me have more information and strong facts and like data and research to back up my argument and my opinion. And I even learned more information on the pricing, cost, and availability as well. Some things I didn't know. Alrighty, some other possible perspectives. I think that people of higher authority may not agree with the government playing a role in decreasing the cost of insulin once you get into the talk of money and all those things and government and laws and insurance and everything gets a little messy. And then those without the conditions or needs of the essential drug may not understand the significance of the cost of prescriptions. So it's hard to like understand someone's point of view when you're not in that situation, is basically what I'm saying. And some gray areas, I think each country Obviously, it's going to have different data, numbers, insurance benefits that will help alter the comparisons, and then different social classes will be affected differently. So people with more money won't be as affected financially as people with very little money. The data was also from 2016, and I know recently Trump has released an executive order to reduce prices of insulin in the US. So this information from this article could soon be outdated, depending on when China updates their laws, when other countries update their laws, stuff like that. Alrighty, and that is the end of my presentation. Thanks for listening. Hope you guys learned something. Thank you.